blood supply of the heart. It is supplied by the right coronary artery and the left coronary artery. Right coronary artery, it arises from the ascending aorta from the anterior aortic sinus. Left coronary artery arises from the left posterior aortic sinus. So I'll show you where the sinus is and how it is seen. So this is the arch of aorta here. I have made a cut at this level, and I want to show you the you have valves is there. The aorta is guarded by a wall, semilunar wall, that is called as the aortic semilunar wall. I will show you here. I have made a cut here for the aorta, ascending aorta, and you see, observe here, these are all the semilunar walls. You have 3 cusps are there. For the semilunar walls, you don't have the fibrous ring, but these cusps, they are attached to the wall of the aorta. So you can observe here, this is the 1, 2 and 3 cusps are there. You have in the aorta, the first letter of the aorta is A. So you have one anterior, A for anterior, A for aorta. One anterior cusp is there and 2 posterior cusps are there. Right posterior cusp and the left posterior cusp. So you have anterior cusp and you have the 2 posterior cusps are there. So if you observe between the wall of the aorta and the cusp, there are some pockets are there. You can see these are the pockets like. So in this one, you can I'll show you the aortic sinus is nothing but between the cusp and the wall of the aorta, you have a gap that is dilated. This part is called as the sinus, aortic sinuses. So anterior aortic sinus, you have 2 posterior aortic sinus and right posterior aortic sinus and the left posterior aortic sinus. This is the left and this is the ostia here. You can see this is one ostia, coronary ostia. This is the left coronary ostia here. This one opening. This is present in the left posterior aortic sinus. Same way you can also see on the anterior side. On the anterior side, we have an opening here. Coronary ostia is seen here on the anterior aspect. So that is the coronary ostia seen on the anterior aortic sinus and left posterior aortic sinus. That is how it right and left coronary arteries will be arising. So now coming to this course of the right coronary artery. So it arises from the anterior aortic sinus and then it descends down between the pulmonary trunk. This is the pulmonary trunk here and the right auricle, and it passes between the groove here, AV groove, right, AV groove, right part of the AV groove, and it goes backwards. See here, it goes backwards into the posterior part of the AV groove. This is the posterior part of AV groove, and it anastomoses with the left coronary artery or the circumflex branch of the left coronary artery here at the coronary groove or the posterior AV groove. So this is about the course of the right coronary artery. The branches of the right coronary artery are, if you observe, this is the groove called as the atrioventricular groove. That means it is between the ventricle and the atrium. So you have branches called as ventricular branches and the branches called as the atrial branches supplying the atrium. So the first branch of the right coronary artery is SA nodal artery. That is nothing but a branch of the one of the atrial branches, we can say SA nodal artery. So as you know, SA node is present just below the superior vena cava, opening of the superior vena cava. So SA nodal artery passes between the arch of aorta and the right auricle, and it passes in front of the superior vena cava and descends down and supplies the SA node. They are the one of the atrial branch, and other atrial branches supply the remaining part of the atrium, whereas ventricular branches, if you observe, the first ventricular branch you have is the right conus artery. Right conus artery, it supplies the infundibulum of the right ventricle. This is the right ventricle, and it joins with the left conus artery of the left coronary artery. They form a necklace like around the pulmonary trunk. This is called as the annulus of Vuesens. Annulus of Vuesens. And the other ventricular branches, if you observe, they give branches supply the right ventricle, and one of the biggest one is called as the marginal artery. It passes along with the inferior border of the heart, inferior border, and reaches up to the incisura epicis cordis here, near to the apex. These are the branches in the in the stenopostal surface. or the first segment of the right coronary artery. After that, it goes to the posterior part, posterior AV groove. So here, if you observe the same thing, this is the arch of aorta and the right auricle. So from here, it goes backwards like this. Here, it anastomoses with the circumflex branch of the left coronary artery. Here it gives branches called as, again you have atrium above, ventricle below. So you have atrial branches are there and ventricular branches are there, and we have one big branch called as the posterior interventricular artery. So it is present in the posterior interventricular groove here. And not only that, you have the ventricular branches here, and one of the ventricular branches from the posterior interventricular, it supplies the AV node here, AV node. So these are the branches of the right coronary artery. Now let us discuss about the left coronary artery. It arises from the left posterior aortic sinus and passes between the left auricle. If you observe, this is the left auricle and the pulmonary trunk. It passes between the left auricle and pulmonary trunk. Here it immediately divides into two branches, that is the anterior interventricular branch here, and you have the circumflex branch, which we say that it goes backwards. And here if you observe, this is the arch of aorta here. From the left side, it passes from the left part of the AV groove and it enters into the posterior part of the AV groove. So this circumflex branch of the left coronary artery reaches the back side, it anastomoses with the right coronary artery. So here the left coronary artery, it is giving rise to main branches called as the anterior interventricular branch. So let us discuss about the anterior ventricular branch. So for this one, it is present between the right ventricle and the left ventricle. You could see this artery here, and it is present in the anterior interventricular groove. And the branches here are, because it is present between the two ventricles, all gives rise to ventricular branches here, all ventricular branches. And one of the right side ventricular branch, it forms the left conus artery. It anastomoses with the right conus artery. It supplies the infundibulum of the right ventricle. And one of the left ventricular branch, it becomes big, that is called as a diagonal branch. Diagonal branch here. This is a diagonal branch. So this anterior interventricular branch, it passes in the groove, anterior interventricular groove, and it goes towards the incisura apicis corticis, and it goes backwards here. If you observe, it goes backwards to the diaphragmatic surface and anastomoses with the posterior interventricular artery, posterior interventricular artery in the diaphragmatic surface. There is an anastomosis here. You can see here in this posterior interventricular groove, we have an anastomosis between the anterior and posterior interventricular artery. And coming to the branches, other branches is the circumflex artery. So if you observe the circumflex artery here in this one, on the posterior aspect I want to show you here. This is the left coronary artery arising from the arch of aorta and then passes between the pulmonary trunk and the left auricle, and then it gives rise to anterior interventricular branch, and here it gives rise to the circumflex branch here. Circumflex branch passes behind, in between the posterior AV groove. So this is the area. Here the branches are, for this one, you have atrial branches are there above and ventricular branches are there. So atrial branches, it supplies the left atrium, whereas ventricular branches, one of it is bigger one, that is called as the marginal artery. It passes in the left border. So, and you have ventricular branches also are seen in the posterior aspect of the AV groove. So you have a branches here of the left coronary artery. Coming to the venous drainage of the heart. So as you know that right atrium, it is having anterior rough part, posterior smooth part. Posterior smooth part have all the major openings into the right atrium from the as the superior vena cava, inferior vena cava, and other openings are also there called as the coronary sinus. So coronary sinus, so the veins of the heart are, all the veins of the heart will be draining into the coronary sinus, a major sinus which is present in the posterior AV groove here between the base and diaphragmatic surface. Between the base and diaphragmatic surface, this is the coronary groove, also called as a posterior AV groove. So there lies the coronary sinus. So coronary sinus is nothing but a large venous sinus, venous channel into which all the veins of the heart drains into that, and this coronary sinus finally drains into the right atrium. Except the two veins called as the vena cavae minimus, and then we have the anterior cardiac veins. Except these two, all the veins of the heart will be draining into the coronary sinus, whereas anterior cardiac veins and vena cavae minimus directly drains into the heart. So 60% of the venous drainage of the heart is into the coronary sinus, whereas the remaining anterior cardiac vein and the vena cavae minimus, they are by the 40% of the venous drainage of the heart will be into those two. Now, so we have the veins are there. We call them as the great cardiac vein here, great cardiac vein, which is passing along with the anterior interventricular artery. So it drains into the coronary sinus. And so we have in the atrioventricular groove, right part of the atrioventricular groove, we have a vein called as the small cardiac vein. This is great cardiac vein, which is along with the anterior interventricular groove. Here in this groove we have the small cardiac vein, and on the posterior side, if you observe, along with the posterior interventricular arteries, you have a vein called as a middle cardiac vein, and just side to that you have another vein called as a posterior vein of the heart, posterior vein of the heart. And you have another vein called as the oblique vein, which comes from the left atrium. It also drains into the coronary sinus. So these are the sinuses: great cardiac vein and the small cardiac vein, middle great cardiac, small cardiac, middle cardiac vein, and posterior cardiac vein, and oblique vein of the left atrium. These are all the veins finally drains into the coronary sinus. So the coronary sinus will be finally opening into the right atrium, except the anterior cardiac vein and the vena cavae minimus. So anterior cardiac vein, it is draining from the infundibulum of the ventricle. So it drains into the right atrium directly. Same way, vena cavae minimus, it drains from all the chambers of the heart and finally drains into the right atrium. So if you observe here, in the right atrium, this is the opening of the superior vena cava, and this is opening of the inferior vena cava, and you have an opening here. This is called as the coronary sinus here, coronary sinus, opening of the coronary sinus into the right atrium. So this is about the venous drainage of the heart.